Chapter 30: Antitubercles, Antifungals, and Antivirals. Tuberculosis, Mycobacterium tuberculosis. This is a transmission from person to person via respiratory droplets, such as things like coughing, sneezing, talking. And the patients at especially higher risk are those of the immunocompromised, living or working in high risk residential settings, injecting illegal drugs, and healthcare workers who are working with these high risk patients. Symptoms would include things like coughing with blood tinged sputum, fever, night sweats, anorexia, weight loss, chest pain, and positive acid fast bacilli located within the sputum. And it would be treated with specific anti tubercular drug therapy. Those first line drugs, as well as those used in drug resistant tuberculosis. And they will often also be combined in that patients will take multiple drugs simultaneously to prevent any of the bacteria from becoming drug resistant. Prophylaxis and protection is recommended for latent TB infections, immunocompromised, those with a positive tuberculin skin test, and those converted from negative to positive TB. Side effects of tuberculosis drugs would include things like headache, dizziness, confusion, and hallucinations, on up to paresthesias, peripheral neuropathy, hyperkalemia, hyperglycemia, ocular toxicity, ototoxicity, and especially hepatotoxicity. These drugs tend to be very toxic to the liver. Another very common ATI and NCLEX question is for patients that are taking rifampin, and that it will turn the patient's sweat and urine orange. Other high risk special populations would include things like pregnancy, those with HIV, pediatrics, the homeless, which have a 10 times higher rate of latent tuberculosis in the general population, and those born outside of the country where tuberculosis tends to be much more prevalent. For anti tubercular drugs, we want to stress the importance of adherence and not creating a pathogen that's drug resistant. We also want to carefully assess for any indication of hearing changes, pulmonary infections, and the patient's going to need to have negative sputum tests for 2 to 3 months after being prescribed. For drugs like isoniazid, we want to give that 1 hour before or 2 hours after meals, and give pyridoxine, vitamin B6, as prescribed with the isoniazid to help prevent any peripheral neuropathy. We also want to carefully monitor any hepatic function tests and stress the importance of not only complying with the regimen, but abstaining from alcohol. These are drugs that are severely, severely hepatotoxic, and we don't want alcohol on top of that. In the case of fungal infections, candidiasis, we want to carefully monitor any mucous membranes, hair, nails, and moist skin areas. We also want to monitor for any spread and systemic infections that could be severe, affecting things like the lungs, abdomen, or central nervous system. Opportunistic infections such as candidiasis, aspergillus, usually occur in immunocompromised or debilitated patients, or those taking antibiotics that have wiped out their normal biota and now left free range for these opportunistic pathogens to spread and multiply. Antifungal drugs could fall into several groups or classes: polyenes, azoles, antimetabolics, echinocandins, or miscellaneous. Amphotericin in the polyenes is another one that is very commonly given. It is a very strong antifungal, though it also comes with several adverse effects and dangers. Amphotericin B, this treats severe systemic fungal infections. It works by binding to the fungal cell membranes, causing cell permeability and leakage of their cellular contents. Side effects would include things like flushing, fever, chills, headache, dizziness, tachypnea, GI distress, paresthesia, and in high doses can also be nephrotoxic, severely nephrotoxic. Our next group of antifungals is azoles. These can go in many routes, everything from oral, IV, to vaginal and topical. And they again work by increasing cell permeability and have side effects including headache, rash, GI distress, hypokalemia, dysrhythmias, hepatotoxicity, and nephrotoxicity. Antimetabolites. These selectively penetrate the fungal cell wall, which again disrupts that fungal DNA and RNA synthesis. They tend to be well absorbed from the GI tract and used in combination with other antifungals, such as amphotericin. They again have the side effects of renal and hepatic impairment. Echinocandins. This is a drug given in the IV route that inhibits biosynthesis of essential components of the fungal cell wall. Side effects include injection site reactions, elevated hepatic enzymes, and histamine mediated reactions. In the case of antifungals, we again want to stress the importance of adherence. We also want to assess the patient's hepatic and renal function carefully. Be careful to monitor any indication of decreased tissue integrity, and make sure that the patient will list any potential complications they need to be aware of and need to be reporting should any occur. Again, we want to advise the patient to take these drugs as prescribed. Advise the patient not to consume alcohol. Encourage the patient to report side effects. Monitor urine output carefully and keep a careful eye out for any renal and hepatic lab results. Viruses. These are transmitted primarily by droplets from coughing, sneezing, talking. And common viral infections include things like influenza, herpes, and hepatitis. Influenza, the flu. It is highly contagious and results when droplets enter the patient's respiratory tract. Could be everything from seasonal to more prevalent within fall to spring. And they come in several types: influenza A, influenza B, and influenza C. The signs and symptoms of the flu include things like high fever, headache, fatigue, weakness, myalgia, watery nasal discharge, red watery eyes, photophobia, and chills, sore throat, and a non productive cough. The herpes virus. Herpes simplex 1 virus causing cold sores. Herpes simplex 2 virus causing lesions on the genitalia. Varicella zoster virus or chickenpox and shingles. The Epstein-Barr virus causing mononucleosis. And cytomegalovirus, which affects primarily patients with weakened immune systems, such as from organ transplant or HIV. Hepatitis. This is a serious liver infection resulting from bloodborne pathogens spread primarily by blood and bodily fluids. Signs and symptoms would include things like fatigue, malaise, nausea, abdominal pain, and jaundice. In the case of non HIV antivirals, these work to prevent or to delay the spread of a viral infection by inhibiting the viral replication. It would include things like influenza A and B, herpes viruses, hepatitis B, hepatitis C, which are two blood-borne hepatitises, and HIV. In the case of influenza antivirals, these work to shorten the duration of signs and symptoms and have side effects for things like dizziness, headache, insomnia, fatigue, GI distress, and abnormal behavior. Herpes antivirals, these again work to interfere with DNA synthesis and are effective in managing herpes simplex viruses, chickenpox, and shingles. Cytomegalovirus, again, this is a virus that's very common, though it predominantly only affects people with weakened immune systems, the immunocompromised, such as organ transplant, HIV, patients on chemotherapy. This drugs work to inhibit the DNA polymerase to suppress viral replication and have side effects like headache, dizziness, GI distress, rash, itching, and hematuria, local irritation, renal dysfunction, blood dyscrasias, and bone marrow suppression and toxicity. The first antiviral we'll discuss is acyclovir. This works on infections, also used very commonly in the case of herpes. For recognizing cues, we want to obtain the patient's medical history, including any hepatic and renal diseases, and generate solutions such as that the patient's signs and symptoms of the viral infection will be diminished or eliminated. That's a very common ATI and NCLEX question, in that the acyclovir for herpes, it works to lessen or diminish outbreaks. When giving acyclovir, we want to carefully observe the patient for any evidence of side effects, check the patient for any superinfection, monitor the patient's CBC for any evidence of leukopenia, thrombocytopenia, low hemoglobin, and hematocrit, record the patient's urinary output with strict eyes and nose, and dilute the antiviral drug in an appropriate amount for this solution. Hepatitis antivirals delay the progression of liver disease and work to inhibit the viral replication. They can have some side effects, including fatigue, flu like symptoms, depression, alopecia, photosensitivity, anorexia, arthralgia, thyroid and ophthalmic dysfunction, hepatotoxicity, and renal impairment. For our first practice question, which teaching for the patient who is taking fluconazole is a priority for the nurse? That be A, take concurrent vitamin B6 to prevent peripheral neuropathy. B, take 1 hour before or 2 hours after meals. C, advise that hypoglycemia may occur with concurrent oral sulfonylureas. Or D, warn that gingival hyperplasia may occur with prolonged use. And that answer is going to be C, advise that hypoglycemia may occur with concurrent oral sulfonylureas. For question 2, a patient has developed active tuberculosis and is prescribed isoniazid and rifampin. Which information will the nurse include in teaching the patient about taking this drug? That be A, isoniazid should be given 1 hour before or 2 hours after meals. B, periodic eye examinations are ordered by the healthcare provider. C, compliance with drug regimen is essential. D, to report any symptoms like numbness, tingling, and burning of the hands and feet. Or E, warn patient that rifampin may turn body fluids a harmless green color. And those answers are going to be A, B, C, and D. Isoniazid should be given 1 hour before or 2 hours after meals. Have periodic eye examinations as ordered by the healthcare provider. Compliance with the drug regimen is essential. And D, report numbness, tingling, and burning of the hands and feet. Answer E is not correct because, again, rifampin turns the sweat and urine an orange or reddish color. Question 3. A middle aged adult is diagnosed with tuberculosis. Which is true of the treatment for this diagnosis? A, treatment may take about 10 days to 2 weeks. B, 2 to 3 agents are usually needed. C, the bacteria is usually resistant to treatment therapy. Or D, treatment for tuberculosis is usually without side effects. And that answer is B, usually 2 to 3 agents are needed. Question 4. When teaching a patient about isoniazid and rifampin drug therapy, which statement will the nurse include? A, take isoniazid with meals. B, double the amount of vitamin C in your diet to prevent the peripheral neuropathy associated with isoniazid. C, notify the primary healthcare provider immediately if your urine turns red or orange color. Or D, avoid exposure to direct sunlight. And that answer is going to be D, avoid exposure to direct sunlight. Question 5. When a patient is diagnosed with candida infection in the mouth, which drug does the nurse anticipate that the patient will be treated with? That be A, metronidazole, B, amphotericin B, C, isoniazid, or D, nystatin. That answer is going to be D, nystatin. When caring for a patient receiving amphotericin B, which is most important for the nurse to assess the patient for the development of? That be A, hypoclemia, B, hypernatremia, C, hypocalcemia, or D, hypermagnesemia. And that answer is A, hypoclemia. And for our final question, which nursing intervention is the priority when a patient is receiving antiviral drugs? That be A, promoting hydration, B, enhanced bowel function, C, increasing tidal volume, or D, promoting circulation. And that answer is A, promoting hydration. But anyway, that's all we got for this chapter. I'll see you in the next slide.